seen that there are different neurotransmitters involved in the autonomic nervous system functions. Acetylcholine is released in the ganglion, and acetylcholine and norepinephrine are released from the postganglion. And you can see, and you also have seen that there are different receptors, alpha and beta for norepinephrine, and nicotine and muscarine for acetylcholine receptors. Now let's see some of the functions of the sympathetic and parasympathetic nervous system. So this image shows the iris muscle in the eye. So you know that we have circular muscle and radial muscles, right? The circular one is innervated by the parasympathetic stimulation or parasympathetic nervous system, and the radial muscle is innervated by the sympathetic postganglion. So both of them are excitatory here. So acetylcholine released here, and norepinephrine, which is released here, stimulate the muscles. But there are different innervation. Acetylcholine activates circular muscle. The result is constriction of the pupil, so we will have miosis, right? But norepinephrine activates radial muscle, so contraction causes dilation of the pupil. We call this mydriasis. So mydriasis is mediated by alpha-1 receptor, but meiosis is mediated by muscarins.
So this one is the post-ganglionic one, sir?
Yeah, both of them are post-ganglionic cells. So preganglionic cells here in the sympathetic nervous system is located in the T1 segment.
T1 segment.
Right? Remember?
Yes.
But what this neuron is coming from? Parasympathetic?
Optic.
So the nerve is oculomotor.
Edinger
Westphal. So the preganglionic neuron in this parasympathetic fiber is from the Edinger Westphal. Another thing that ANS do on the ciliary muscle in the eye is contraction of the lens, or let's say contraction of the ciliary muscle, which can cause relaxation of the lens or convection of the lens. Okay, let's see what happens here. So we have the cornea of the eye here, anterior chamber, posterior chamber, the lens is here. The lens is suspended by some ligaments here called zonule of the zine. Zonule of zine, okay? So these ligaments are attached to ciliary muscle here. So we have ciliary muscle here and here. So it's different from the iris. Right? Iris is for pupil, but ciliary muscle is for the lens. Ciliary muscle is a circular muscle. When it contracts, it becomes narrower. Constricted. Right? So contraction causes, let's say, constriction. So what happens? When the ciliary muscle is activated and contracted, these ligaments becomes looser. So the lens becomes relaxed. Right? When it's relaxed, it becomes more convex. So this is the lens. Okay? When it is relaxed, it becomes more convex. When it is stretched, it becomes more flat. You know about the lens, that if it becomes more convex, then the refractive power increases. So when the light comes here, it is bent here, and the focus will be near the lens. If it's flat, then when light comes here, it goes further. So you will have the focus of the lens which is far from the lens. So this one is very good for near vision This one is based for far vision, right? So, ciliary muscle is activated by parasympathetic nervous system. So, contraction happens here, lens become more convex, right? So, this is good for near vision. When sympathetic fibers actually stimulates the ciliary muscle, there is a slight relaxation through the beta 2. So the lens become more flat, right? The result will be less accommodation or far vision. So parasympathetic innervation to the eye causes miosis and accommodation, near vision. Sympathetic innervation to the eye causes mydriasis plus relaxation of the lens. It is best for far vision. Relaxation of the ciliary muscles is mediated through beta 2 receptor. Contraction is mediated through which receptor? The receptor muscular. So in the parasympathetic nervous system, all functions are performed by muscular receptors. Nicotine receptor is only present in the ganglion. In target cells, you have only muscles. So in the heart, you have muscle receptor. In the eye, muscle receptor. Vessels, muscle receptor. Everywhere. Okay? So, salivary glands. In the mouth, they secrete saliva. Right? Parasympathetic innervation occurs through nerve number 9, glossopharyngeal, and nerve number 7. Remember that nerve number 7 was associated with superior salivatory nucleus. Nerve number 9 was associated with inferior salivatory nucleus. Right? So, glossopharyngeal nerve, nerve number 9, goes to the optic ganglion, then to the parotid gland. Right? So, facial nerve through the submandibular ganglion goes to submandibular and sublingual nerve. So, inferior salivatory nucleus through the nerve number 9 go to the optic ganglion, then to the parotid gland. So it secretes saliva. In superior salivatory nucleus through the facial nerve go to the submandibular ganglion, then to the submandibular and sublingual glands. So parasympathetic innervation causes plenty of secretion. Profuse means plenty, right? So a lot of watery secretion happens in the saliva. But sympathetic innervation is by way of T1 through T3 segments that go to the superior cervical ganglion. Then from here they go to the salivary glands and also to the blood vessels. So they cause thick and viscous secretion. Saliva becomes less but thick, viscous. So this happens by way of alpha-1 receptor. So the action of the sympathetic nervous system on the salivary gland is through alpha-1 receptor. And amylase secretion happens by way of beta receptors. So let's see the connection. Superior and inferior salivatory nuclei sends the fiber through the facial nerve or glossopharyngeal. Facial nerve goes to the submandibular ganglion. Glossopharyngeal goes to the optic ganglion. So from here, parasympathetic postganglionic neurons go to the submandibular and sublingual gland. This one goes to the parotid gland. All of them secrete saliva. Parasympathetic innervation causes plenty of saliva secretion, which is thin, not viscous, right? But this system can be controlled reflexively by taste and sensory information from the tongue. So they go through the lingual nerve, remember this? Go to the nucleus of the tractus solitorius. From here they go to the superior inferior salivatory nuclei. They activate the parasympathetic nervous system. They cause secretion of the saliva. So when you taste something, saliva is secreted reflexively. Right? So taste increases secretion of the saliva. This is the pathway. Sensory information through the chorda tympani and lingual nerve. Right? They go to the nucleus of the tractus solitorius, then to the salivatory nuclei, then through the nerve number 7, nerve number 9, they go to the salivary glands in the mouth, they secrete saliva. So, there is a table in your book which specifically mentions all of the functions of the sympathetic and parasympathetic nervous system on any organ in the body. Okay? So let's see some of them, and then you can memorize all of them by yourself. Right? So on the glands, so we have nasal gland, lacrimal gland in the eye, which secretes tear, right? Parotid gland, submandibular gland, gastric gland, and we have also pancreatic gland. So all of them are actually activated by the sympathetic nervous system, which cause a very small amount of secretion. And the secretion is usually accompanied by vasoconstriction. So sympathetic nervous system causes vasoconstriction in these glands. The result is less secretion. Right? But parasympathetic innervation stimulates a lot of secretion from these glands. So the stimulation of parasympathetic nervous system on all of these glands is plenty of secretions, right? Sweat glands in the skin. So, sympathetic innervation causes copious sweating, a lot of sweating, but parasympathetic innervation only causes secretion from the sweat glands in the palm, only this. So the body is innervated by the sympathetic nervous system, but the palm is innervated by parasympathetic nervous system. The sweat glands are activated by cholinergic neurons in the sympathetic nervous system. This is an exception. Remember that? I told you that instead of releasing norepinephrine, these fibers release acetylcholine. Receptor is muscle. Again, muscle. Right? Apocrine glands in the armpit. Right? So they are activated by sympathetic stimulation, which causes thick and actually odoriferous secretion. So it smells bad actually. Right? So during stress, these glands are activated by sympathetic nervous system, causes thick secretion, which smells very bad. Okay? So, but parasympathetic innervation doesn't have any effect on these glands. So there is no parasympathetic innervation to the apocrine glands.
Sir, apocrine glands present in which one?
Which area of what you mean?
Yes.
Armpit. Okay? Also. So, blood vessels are usually constricted by sympathetic nervous system, but there is little effect of the parasympathetic nervous system on the vessels. So there are also other things I mentioned here. One important thing is this one, sweat glands, which are activated by cholinergic fibers. Okay? They are actually controlled by hypothalamus areas. But these hypothalamic areas are considered parasympathetic centers. So this is very complex actually. So in the hypothalamus, we have parasympathetic centers which activate sweat glands through sympathetic nervous system. So center is parasympathetic, fiber is sympathetic, right? Neurotransmitter is acetylcholine, right? So this is a very complex exception for innervation of the sweat glands. GI system. So the gut has two-part lumen and sphincter, right? Sympathetic innervation causes relaxation in the lumen and contraction in the sphincter. So the tone increases in the sphincter, the tone and crystallis decreases in the lumen. But parasympathetic innervation has the opposite effect. Lumen is contracted, sphincter is relaxed. Right? Liver.
Parasympathetic increase the GI motility.
GI motility, yeah, motility and secretion also. So liver, glucose is increased by sympathetic activation, but glycogen is made by parasympathetic innervation. Gallbladder and bile duct is relaxed by sympathetic innervation, contracted by parasympathetic. Heart rate increases by sympathetic innervation, contractility also increases. Coronary arteries are dilated by way of beta 2, but alpha causes constriction. The balance is slightly in favor of dilation. Okay, so both of them happen, but when sympathetic innervation causes activity in the heart, coronary arteries are slightly dilated. Okay? But parasympathetic stimulation causes decreased rate of heart beating, decreased force of contraction, and dilation of the coronary arteries. So, arterioles, blood vessels in the body, in the abdomen, in the muscle, in the skin, are mainly constricted by sympathetic innervation, but parasympathetic stimulation doesn't have any effect. So you should also memorize the receptors. So alpha receptor causes constriction. Where? Muscle. Dilation in the muscle happens through beta 2 adrenergic receptors or cholinergics. In the skin, sympathetic innervation causes constriction. So, in the lung, sympathetic innervation causes dilation of the bronchi, right? But blood vessels are constricted. Parasympathetic innervation causes constriction. So parasympathetic innervation causes bronchoconstriction, right? So if you inject a drug like atropine, which blocks muscarine receptors, then what's the effect of this drug on the bronchi?
Like constriction. Because of relaxation.
So atropine blocks muscarine receptors.
Inhibits contraction.
It's an antagonist of this receptor. So acetylcholine causes constriction through the muscarine receptors. Now you block the muscarine receptors. Result will be dilation. So in order to increase in order to dilate the bronchi, you can use a sympathetic drug or a parasympathetic antagonist drug or a parasympathetic blocker, right? So, kidney. In the kidney, we have decreased urine output and increased renin secretion by the sympathetic innervation, nothing by the parasympathetic innervation. Bladder. We have two muscles in the bladder, detrusor and trigon. Trigon has actually functions like a sphincter, right? So, sympathetic innervation causes relaxation of the detrusor and contraction of the tribe. So the result is the urine is actually remains in the bladder, right? But parasympathetic innervation causes contraction in the uterus and relaxation of the tribe. So it's in favor of urination, right? So parasympathetic favors urination. Sympathetic is against the urination. In penis, ejaculation happens by sympathetic innervation, erection happens by parasympathetic stimulation. In the blood, coagulation, glucose secretion, lipid secretion, all increased by sympathetic stimulation, nothing happens by parasympathetic. Basal metabolism is activated by sympathetic innervation. Adrenal medulla secretes norepinephrine and serum, and norepinephrine and epinephrine. Right? When sympathetic stimulation happens, remember that? I told you that there is only preganglion innervation to that.
Yes.
They secrete norepinephrine and epinephrine. Catecholamines, right? Mental activity increases by the sympathetic stimulation. Pyeloelectro muscles, hair on the skin, are erected by sympathetic stimulation. So that's why when we are frightened severely, when sympathetic innervation stimulates the muscle, the hair, we will have pyeloerection, right?
Sir, during sympathetic stimulation, the mental activity increase.
Yeah, increases.
In stress, our mind works more.
Yeah, so when you are stressed out, the mental activity increases. Okay? You are more aroused, actually. You are ready for anything that may happen. You are ready for fight. So mental activity increases.
Do you have any case which affects the parasympathetic but not affect the sympathetic?
Yeah, for example, sometime you may have seen that people actually experience faint. You know faint? They lose consciousness. So blood pressure decreases suddenly and the person falls. Right? So this is a case of parasympathetic activation. The parasympathetic activation causes faint if there is mass activity. So I will talk about this, okay? When the whole parasympathetic system is activated.
Sir, is it possible to activate parasympathetic if there is no sympathetic stimulation? Because the function of parasympathetic stimulation is to relax our body. In emergency situation, the sympathetic system activate to overcome it, to make our body relax. The parasympathetic stimulation activates. So for the parasympathetic stimulation, there must be sympathetic stimulation. There must be stress condition.
For sympathetic activation, you mean?
No,
not
sir.
for parasympathetic.
For sympathetic, there is our body prepares for the emergency situation.
Yeah, with sympathetic, not
Yes,
with parasympathetic.
in a sympathetic situation.
Yeah.
But parasympathetic brings our body to in a relaxed situation, in normal situation.
In normal situation,
Yes, sir.
no. There is a balance usually between sympathetic and parasympathetic stimulation. So in the resting state, in physiologic condition, they are balanced. For example, when you are awake, maybe sympathetic system is active, in the whole body, I mean. But when you sleep, usually parasympathetic stimulation governs the body. So that's why during the sleep, the GI system is very active, right? Or other system. For example, heart beating gets lower, blood pressure gets lower during the sleep. But when you are awake, you need more sympathetic stimulation. You need blood pressure, you need heart rate, you need, I don't know, GI system should be suppressed. Okay? So usually there is a balance between these two systems. And this is not the case that the whole system is active for sympathetic and the whole system of the parasympathetic is inactive. No, it's not like this. So I told you, for example, in the eye, both sympathetic and parasympathetic innervation happens in the eye. So sometimes you need the sympathetic innervation, okay? Some other time you need parasympathetic innervation. So when light is abundant here, parasympathetic innervation causes meiosis. When you go out of this room and it's dark, then sympathetic innervation causes dilation. Right? So both of them are actually performing at the same time. It depends on your need, the need of the body. Okay? But sometimes, for example, during the stress, there may be entire activity, hyperactivity in the entire sympathetic nervous system. Okay. This is actually an unusual case.
Causing faith.
Yeah. So sometimes there will be faint because of the parasympathetic activation. Sometimes there will be fight and flight reaction when the sympathetic nervous system is active. Okay? So try to memorize the details in this paper. Okay, you need them actually. So now let's see some other examples of autonomic reflexes, like the barrel reflex. So I told you at the beginning of this class, right? Remember? We have baroreceptors in the carotid sinus. So they are sensitive to pressure. So when pressure gets higher or increases, the baroreceptors are activated. Baroreceptors are innervated through glossopharyngeal nerve. The sensory fiber is here, right? So glossopharyngeal nerve has its cell body in there. In the pons and medulla, which nucleus? Superior salivary, right? Okay. So, but the cell body is here.
Which English?
Actually, I think it's in the DRG. No, it's not.
No,
sorry,
it's
it's not in DRG. The sensory nucleus of the glossopharyngeal nerve.
Otic ganglion.
Otic ganglion?
Yes.
Oh.
Otic ganglion.
Remember, this one is sensory. Okay? So it's a sensory neuron. So maybe it's located in the
Trigeminal ganglion.
parabrachial, I don't know.
Trigeminal ganglion, sir. Because sensation, general sensation comes through the trigeminal system.
Trigeminal, yeah, but this is the somatic, right? Somatic sensation. General somatic sensation goes to the trigeminal.
Yes.
But this is not somatic, it's visceral.
So I would say, where will be the first order ganglion?
I don't know. So I should search for that. Okay? So the sensory neuron goes through the nerve number 9, glossopharyngeal. They go to the medulla, the nucleus tractus solitarius, NTS. They end here, and they activate another neuron here. These neurons go to the caudal ventrolateral medulla. Caudal ventrolateral. They release glutamate. So this one is excitatory. This one is also excitatory. But neurons from the caudal ventrolateral medulla are inhibitory. They release GABA onto the rostral ventrolateral medulla. The rostral ventrolateral medulla sends glutamatergic neurons to the intermediate lateral zone of the spinal, thoracic levels. Right? So from here we have the preganglionic nervous system. Preganglionic sympathetic neurons. They go to the ganglion here. They activate the postganglionic neuron, which innervate the heart, the vessel, and the preganglionic neuron also innervate the abdominal medulla. So, norepinephrine and epinephrine is secreted here. These neurons are activated, they increase heart beating, actually, they also increase contraction of the heart, they cause constriction. But because the stimulation here was increased pressure, activity in these neurons activated this one, but this one was inhibitory. This one inhibitory neuron reverses all of the circuit function. So the result is less activity in this neuron, less activity in this neuron, and less activity in this neuron. So heart beating decreases, blood vessels are dilated. The result is
Decrease in activity.
So in response to increased pressure, there will be decrease in the pressure. Right? So this decrease brings the blood pressure back to the normal situation. When there is decrease in the blood pressure, then baroreceptors are not activated. They won't activate NTS neurons. NTS won't activate CVLM neurons, caudal ventricular neuron. So this inhibitory neuron will not be active. So this neuron is released from the inhibitory action of the GABA. So it can activate the sympathetic nervous system. Sympathetic nervous system activates heart and blood vessels. Blood pressure goes up. Right? So this is the action of the baroreceptor reflex.
How glutamic inhibitor will activate GABA receptor?
This one,
Yes.
so glutamate is released, binds to the glutamate receptor, causes EPSP in the cell, the cell is activated. But this cell itself is inhibitory. When it's active, it releases GABA. So GABA inhibits this. So this cell activates this one inhibits this.
The ganglia are glosopharyngeal is superior ganglia, which is present in jugular.
Sorry, again?
Ganglia for glosopharyngeal is superior ganglia.
Superior.
Yes, which is present in jugular. From them exit to
Yeah. Superior salivatory, you mean?
superior ganglia.
Superior ganglia.
It is present in jugular.
Here you mean
First order neuron.
this one,
Yeah.
superior ganglion.
Yes.
So the name is the superior
Main
ganglion.
superior ganglia for the glosopharyngeal.
Where is it located?
Jugular foramen.
Jugular foramen. Okay, good. So this neuron is located in the superior ganglion, located in the
Jugular.
jugular foramen. Good, thank you. So, the other reflex is a reflex for controlling urinary excretion. So in the bladder we have detrusor muscle and triglyceride muscle. Right? So let's see the innervation. Sympathetic innervation is from the lumbar segment. Preganglionic neuron go to the ganglion. Right? I think it's inferior mesentery. No?
Inferior goes to intestine.
So you know the anatomy. So they go to the either maybe hypogastric, I don't know. So we have it here, no? So let's remember it here. This one, hypogastric plexus. They go to this ganglion, so there is no name here. Right? Okay. Okay, from here we have the postganglionic neuron that innervates both the detrusor and triglyceride. Remember from that table I told you, detrusor is relaxed, triglyceride contracts by the action of the sympathetic nervous system. So, detrusor is relaxed, the minus here, the triglyceride is contracted. So the sphincter, the internal sphincter is closed. So, here you can see the parasympathetic innervation. It originates from the sacral region, right?
S2
is 2 and 3 is 4. So from sacral region, we have 3 ganglionic parasympathetic fibers that go up to the wall of the bladder. From here, we have the postganglionic neurons that innervate both the detrusor and trochlear. The effect is contraction of the detrusor, relaxation of the trochlear. So it's in favor of the urination. So these are innervation, right? So there is also sensory innervation. Let's see this. The neuron is in the DRG, right? So it comes from the bladder. So when the bladder is stretched, when it's full and it's stretched, sensory neurons are activated. They send the action potential to the spinal cord by way of these neurons. So some of the information come back to the bladder by way of the parasympathetic neurons. You can see here, right? So they activate parasympathetic innervation, so they can cause urination. But some other information goes upward in the spinal cord, they go to the pons. So they end here in the pons, and they make synapses with other descending neurons. These descending neurons come to the lumbar segment and sacral segment, right? So they can inhibit the sympathetic innervation. So sympathetic innervation was already acting in order to prevent urination. Now they are inhibited, right? And other cause activation of the parasympathetic neurons. Parasympathetic neurons actually are in favor of urination. So sympathetic neurons are inhibited, parasympathetic neurons are activated. There is also other pathways that go to the pudendal nerve, which is somatic nerve. So it can voluntarily inhibit the external sphincters. External sphincter is skeletal muscles. So it's under the control, under conscious control, right? So it can inhibit the pudendal nerve, so external sphincter is relaxed. So all of these can cause urination, right? So urination can be controlled both by reflex action at the spinal cord and also some descending pathways from the
conscious.
Got it? Okay, other autonomic reflexes, you can see only the names. Secretion of digestive juice, emptying the rectum, which is similar to this. Okay? And sexual reflexes, regulation of the pancreatic secretion, bladder emptying, kidney excretion of urine, sweating, and blood glucose influction. So these are other autonomic reflexes. So there should be sensory information to the sympathetic and parasympathetic center. Then there should be motor signals back to the internal. Okay, mass discharge versus distal discharge. We talked about this actually. Sometimes simultaneous discharge of almost all portions of the sympathetic nervous system may happen as a complete. So the whole sympathetic nervous system can be activated at the same time. Okay? But this is actually happen only in very rare occasions. But maybe and normally activation occurs in isolated portions of the sympathetic nervous system. For example, for the regulation of the heart, sweating reflexes, and GI reflexes. Parasympathetic system usually cause specific and localized responses. Okay, so we don't have usually mass activation of the parasympathetic nervous system. So there are only some rare cases. But during the stress, there may be actually sudden and entire activity in the sympathetic nervous system. So fright or severe pain may cause activation in the hypothalamus, which results in mass discharge of the sympathetic nervous system. So this system activates the whole body, okay? in order to prepare for fight or flight. So this includes increased arterial pressure, increased blood flow to muscles, but decreased blood flow to the GI system. So the blood is shifted from the GI system to muscle. So the muscle can contract and the person can fight or can escape, right? So there is increased metabolism in the body, so energy is available. Right? Blood glucose concentration increases. Glycolysis in the liver increases. Muscle strength increases. Mental activity increases. And coagulation ability of the blood also increases. So all of these are the actions of the sympathetic nervous system. So stress can activate the entire sympathetic nervous system, and the sympathetic nervous system can do all of these, so the person is very ready for fight or flight. So we call this fight or flight reflex. So that was all about the sympathetic and parasympathetic nervous system. You can ask your questions now.
Increase the blood coagulation, but in sympathetic blood flow is increased. What about the coagulation?
So, coagulation abilities, right? So when there is bleeding, it can be coagulated. So a clot is made, and it causes stop of the bleeding.
In case of bleeding.
Yeah, in case of bleeding. So blood flow increases to the skeletal muscle. But if there is any injury, then the blood can make clots faster than normal because of the activity of the sympathetic nervous system. Okay.
So why is sudden falling of blood pressure? Falling of blood pressure is more dangerous than high blood pressure.
Because when there is abrupt decrease of the blood pressure, then blood supply to the brain is stopped. And I told you before, only 5 or 10 seconds of ischemia in the brain is enough for losing the consciousness. So the person falls down, there may be some damage, and the consciousness is lost. So this is very dangerous for the person. But actually increasing the pressure may provide only one risk: rupture of the blood vessel.
Rupture of the blood vessel.